Concepts applied when trying to help patients with end-stage liver disease, cirrhosis, hepatitis, when specifically related to alcohol disease, and any time, of course, right? We're always trying to make sure that we're remaining and actively trying to create a judgment-free environment, which means that when taking health history, when taking social history involving alcohol use, maybe continued alcohol use, even if it's been told that they need to discontinue, that we're only there as a patient advocate, right, to help them. They're there to seek healthcare, right? So we are there to provide that and not to provide judgment against their character, but to be there as their advocate. Don't take it personally, right? So these patients, especially if they are a little disgruntled or if they're going through with withdrawal symptoms, if they're needing to stop drinking, don't take it personally if they get short with you or curt or something like that, right? We're professionals. We're there to only be objective and to express care. Make sure that you do, while you're rooming them, right, you're doing all these things, make sure you do good medication reconciliation. We mentioned earlier, we need to make sure that we know the dosages that they're taking so it doesn't affect their liver, as well as a lot of medications that they are taking may be medications that are helping to control some of those complications of cirrhosis, like the extra edema or the hemorrhaging, the risk of hemorrhaging. So making sure that we know what they're taking and that they're getting timely refills in advance, making sure that they never have to go without, and we know what pharmacy they want it to go to. Do you want 90-day refills? If that physician's okay with it, we make sure that we make it easy for them, right? And we let them know exactly where it's going to go. We take good vital signs, of course, always, right? But patients with cirrhosis, weight gain is such a big deal with swelling, ascites, edema. We need to make sure that we're taking really good, accurate vitals. So if you take off the shoes and make them empty their pockets each and every time, get to know that and make sure that you're doing it each and every time so you get as accurate weight as possible. Patients with cirrhosis are much more prone to hemorrhaging, as you know by now, watching other complications. So we need to make sure that when we do things like venipuncture, that hemostasis is achieved, that we're only poking in patients that into veins that we know where it's going to be, and that we're trying not to go too deep, and certainly not doing anything that you would never do, right? Like fish around, because any excess damage that's done, good pressure needs to be held for at least 5 minutes, pressure for 5 minutes to make sure that is done. Excuse me. Ooh, my alligator's backwards. And then patience. With this too, right? But also, one of the end-stage cirrhosis complications is hepatic encephalopathy, which can lead to confusion, difficult conversations, some irritability, potentially some aggression. So just having that patience and again, not taking it personally. That's how we try and provide that most patient-centered care and the most responsive care to our patients with cirrhosis. Once again, thank you very much to the American Liver Foundation that has provided most, if not all, of the clinical pathological information for these series of videos on cirrhosis.